Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast. The College Connection podcast is made available to registered nurses and nurse practitioners as a resource to promote good practice and to highlight the importance of regulation in healthcare. My name is Kelly Kane, and I'm a nursing consultant with policy and practice at the College of Registered Nurses.
And I'm Michelle Carpenter. I'm a registered nurse, and I'm a nursing consultant for policy and practice, also at the college.
We have a very interesting show for you today as we discuss the retention of registered nurses in Newfoundland and Labrador Health Services. And our special guest today is Collette Smith with Newfoundland and Labrador Health Services. Collette, please introduce yourself to the audience.
Well, it's a pleasure to be here. Hi there, everyone. As Kelly said, I'm Collette Smith. I am a registered nurse by background. Graduated a long time ago, back in '93, from St. Clair's School of Nursing. So hi, my alumni out there. And went on actually to have a lot of great different experiences, but eventually ended up in the world of human resources. And it's been an incredible journey in learning for me as a registered nurse to bring to the table that background, but also learn human resource business within Newfoundland and Labrador Health Services. So I did go on to do my degree in health arts and my master's in business administration with a concentration in human resources. And currently now I am the Senior Director of Recruitment, Retention, Education and Culture within Newfoundland and Labrador Health Services. And I really wanted to thank you for having me, and it's a pleasure to be here with you all.
Excellent. Thank you, Collette.
Collette, just by telling us about your background, it just illustrates the diverse practice settings and domains of practice that nurses can engage in. And we talk about that with nursing students when we go in and present in their curriculum. So you're a great example of that, so thank you.
Absolutely.
It's incredible, isn't it? We meet nurses everywhere.
Absolutely, for sure. We've heard over the past number of years that Newfoundland and Labrador Health Services has been laser focused on recruitment of registered nurses. And many of our own nurses have asked about retention. We get that question a lot. So what are the retention strategies that you are implementing for nurses currently within the system?
Fantastic question, and absolutely we've had a focus on recruitment. We certainly have been through a challenging number of years, and we recognize that we have a gap in our resources that we need to help stabilize within the province to be able to provide the care for the people within the province and to make sure that our registered nurses have colleagues by their side and the right team complement to be able to do the care that they want to provide and to provide that to their patients and residents. So I would suggest to you that recruitment is actually a huge element of the retention strategy, because until we are successful in recruitment and can make sure that you have the right people with you caring for who you're caring for, we will always feel unable to meet those needs. So we've talked a lot about the recruitment in the previous podcast. So maybe if folks haven't watched that, you can hear about our recruitment efforts in that one.
Absolutely.
But on the retention lens, we're also trying to listen very hard to our current folks within our new Newfoundland and Labrador Health Services team. We have a retention task force formed within Newfoundland and Labrador Health Services. It was one of the first groups that we actually formed, and it was previous to any of the management structures being finalized even. We knew right then we needed to start to listen to our frontline team members in how we can get better at retention.
Absolutely.
Mm-hmm. And so there was a call put out for volunteers. This task force is actually made up of mostly frontline people from across the province, all roles, all responsibilities, everyone welcome kind of philosophy. And we've discussed and planned quite a bit on the retention front. And this group helps us have ears on the ground to frontline. A lot of times we are not able to hear every voice that we want to hear, but this group allows us to do that, connected really into where people are actually working and bringing back to us what they're hearing and what the experience is so we can get better at retention. So that group has formed multiple strategies and has prioritized some pieces of work that they're hearing are the first elements that our people want to see in terms of retention. So specifically, to get started, we chose 4 areas.
Okay.
And we know that we have influence within our healthcare system to build and make things better. And we wanted to choose things that we could actually do. And we could actually visibly be seen to be improving within, so that folks would know about the retention task force and hopefully gain momentum as we went. So the areas that we've really been focused on are first and foremost a grow your own strategy.
Okay.
And some of you might have heard about this within Newfoundland and Labrador Health Services. Our intention is to make sure that every individual within the organization has a good, supported career path for themselves.
Okay.
And that career path could be anything from building their expertise up towards even the CEO level, or it could be, I want to be the best registered nurse I am right here where I am because I love where I am. And so we've been building education, course development. You'll see things come out actually promoting different educational opportunities. This is for all disciplines. So even if you see things come out for your colleagues in terms of formal educational programming, did you ever want to be, and we may name a profession, we're supporting people to go back to school and augment their current education qualifications to fill the needs we have.
Wow.
So what that does for us is it gives us an ability to fill roles that we know we need, but it gives people an opportunity to fulfill their career dreams and to do it with us. We want people to see that they have a career pathway within Newfoundland and Labrador Health Services, and they can find what they're striving to be and looking for right here within our own organization. So that's one area of retention. Again, just watch for some of the things that we have coming out, and if there are any thoughts or ideas about other elements of that, certainly the task force is open to it. Another key area that we heard that's impacting our retention is actually our diversity work. And we've been quite active in trying to build a community and an organization that's aware of and respectful of all of us as people as we're building into a more diverse society and trying to be inclusive. Specifically, unfortunately, we've heard need to work on attitudes within our organization and even in the province related to racism. So anti-racism is actually one of the other pillars that the Retention Task Force prioritized for us, because it was just so not acceptable for us to tolerate any of that within our culture and within our province in general. So you would likely have seen a lot of promotion, a lot of education and awareness from our council. We have a Diversity, Equity, and Inclusion and Reconciliation Council that does fabulous work in terms of education, setting expectations, talking openly about experiences, and acceptable no tolerance of racism within our workforce. So that again came from our retention work. If you can imagine the impact if someone is experiencing that has on the individual first and foremost, but I'm retaining a good workforce. It's incredible. So that's another piece of work Retention Task Force asked us to prioritize, and we did. A third element that we've been working on, and again, maybe it's difficult to connect all of this as retention strategy, but it's absolutely, I think, paramount to people, is good leadership development.
Yes.
We know for all of us, including our registered nurses, one of, if not the most important relationship you have in the workplace is with your leader.
Absolutely.
Your leader is there to support you, to listen, to try and improve things on your work, in your work area, to try and help you grow, to deal with the dynamics within your area. They're probably the most influential in how you're feeling and your experience within your career. And so the investment in making sure that leaders have the tools that they need and the support they need impacts everyone. So we've completely redesigned our onboarding of new leaders, new managers. We've set up mentorship communities for new leaders. Their orientation and development has been built, and you'll see that in action as we go forward. We've launched a leadership academy within Newfoundland and Labrador Health Services.
wow.
So leaders have one place to go to find the tools and material that they need. And we continue to build. We actually just started an emerging leaders program. Some of you might even be part of that or have heard of that. What we know is we need to get leaders ready even before they take on or consider formal leadership roles. So there are about 60 or 70 folks right now enrolled in our emerging leaders program. And that is for folks who may be interested in considering leadership roles or becoming formal managers or even informal leaders. So that investment, again, brought forward as a retention strategy, brought forward by Frontline to say, please help us build our leaders so that we can be supported in our workplace. And finally, the fourth priority that the Retention Task Force asked us to look at was actually wellness.
Wow. Okay.
And I think that can resonate with everyone. Wellness is a broad topic. We are talking psychological wellness, mental health, physical wellness, well-being in the workplace. That group has been working very, very hard on a strategy. Huge mountain to climb, but slowly, step by step, are taking on some work that hopefully people are starting to see. You will see within our organization now a whole redesign of our employee and family assistance program just being launched. That came from some of that work. You will see more responsiveness and more options for the different supports you might need. We're starting to work on a charter concept for work-life balance. That one's been really interesting because how we achieve work-life balance is very different depending on the role you are in within the organization. What I can do in my role versus what a frontline registered nurse can do in their role, or what we need to support folks to achieve that, looks very, very different. But the principles are there, and we're trying to introduce that throughout the workplace to be consistent and know that we have an ability to put things in place to achieve that, as difficult as it might seem right now. You'll see some more offerings about wellness throughout different parts of our geography. And each part of our province has different perspectives, needs, wants, preferences. So we're starting to launch things in terms of wellness to match the needs right in there in the communities. Everything from workout programs, internal gyms, even some of just the basics of community support and peer groups to support people. So again, this is all the work of the Retention Task Force. Those things came from Frontline that we want to see. And if we knit that together, it's starting to build a huge retention framework. One of the neatest things we've done within the HR team, I don't know if people are aware or not, is that we've actually invested in a resource for retention. And Michelle, you started by asking me about the focus on recruitment.
Absolutely.
We have lined that up intentionally with a group that's focused on retention so that they can begin to only see the priority of retention alongside our recruitment efforts. So there's definitely more to come. Just as the organization has been building, so has HR. So we're just getting that team in place. And you will see a launch of some really intentional work. There's so much we've been doing, and there's so much that we can't control as the organization. We're really trying to focus on the things that we can,
Absolutely.
that will make a difference in the everyday life of all of us who work within the system.
Wow.
Yeah, Collette, I have to say, I don't know, I'm not sure if it was intentional or unintentional, but as you're talking about some of those pillars of retention, it kind of ties in with our standards of practice, because I'm thinking a lot of the indicators that are there, like advocating for resources. So nurses can have a voice about, retention strategies. Anti-racism, nurses are expected to have cultural safety and humility. So it was just really interesting. And then you talked about leadership. Well, standard 4.1 is that nurses, and RNs and NPs have formal and informal leadership roles in their practice settings. So I was sitting here and thinking, oh my gosh, like, did they do that intentional or not? But, it really, I guess, emphasizes the importance of registered nurses can have a voice in those retention strategies and to get involved, and that so that nurses can play a role in advocating for and building this retention plan. So it was really, I think it was an eye-opener for me, and it also kind of connected with one of our objectives in our current act, in that, we encourage registered nurses to engage in activities that promote the health and well-being of the public. So having a appropriate supply of registered nurses to provide the care really meets that objective of being a professional registered, self-regulated registered nurse.
That's really interesting, Michelle. And you're absolutely right. It aligns with our standards and some of our objectives as a profession, and it speaks really, doesn't it, to what people are asking for.
Yeah.
And again, maybe not recognized as a fulsome retention strategy, but so important nonetheless. And hopefully we'll achieve success through all of that. The voice of the nurse is paramount in some of this, in all of this. And we need to hear if this is resonating with you and what else we could be doing. And it really is our responsibility, isn't it, as a profession to promote that.
Absolutely.
And that kind of leads into my next question, Collette, because we do hear that registered nurses feel that they are being overlooked. So what are you hearing? What are some of those key themes that you are hearing from registrants or from registered nurses and nurse practitioners through your conversations?
Absolutely. And again, I think we have a lot of learning on how to hear, listen, and obtain the voice of everyone within the organization, and definitely with the registered nurse community. We are hearing, and we are trying to listen and trying to hear from you. What we're hearing is definitely about the stress and about the demands in the daily work. And so while all of the strategies that I've just talked about aim to make that better, it remains a fact that people are feeling very much the demand and stress right there every day in the clinical setting. So I guess I'd like to say we do hear you, and we're working towards trying to make that better. We have some things in play for that as well. We've talked about creative scheduling so that people have some control over when they work and how they balance their own personal lives. In a lot of our units, you would probably recognize and have seen that we've introduced the self-scheduling guidelines. And so nurses own that. And they are managing it differently depending on where they work. But definitely depend on and rely on the nurses to succeed with that. Here absolutely to support it, but we're hoping that's making things a bit better. I did mention the recruitment strategies in terms of stabilizing our workforce. Again, is key to that, because we need adequate resources to start to feel the impact that's going to have on the workloads within the units and the demands that are on you. So we need to embrace and support, as we've been doing, the new practitioners that we've had join our teams. And if we can succeed with retaining them, that will lead to that stability that we're hoping to have. I mentioned the retention task force.
Yes.
The retention task force is a completely voluntary group, and it is meant to be and is frontline folks, frontline people on NLHS's team. And so a voice we seem to be missing at that table is the registered nurse. And we recognize it's difficult to join another group or have another obligation. But boy, we need your voice. So let us know how we might be able to embrace that feedback. We do have formal pieces of work happening, like surveys, and we are going to be doing and have been doing a lot of walking through units to have conversations with frontline people, of course, our registered nurse community. So we will be open to and embracing any feedback you have. But if anyone would like to get more involved and be right there at the table with helping plan this retention strategy, we would be grateful, and we need you. So I put that call out there if anyone is interested.
Excellent.
Excellent. So with an organization as large as Newfoundland and Labrador Health Services, stretching from Newfoundland right up to the tip of Labrador, how would you address the diverse needs of nurses located throughout Newfoundland and Labrador?
We are such an interesting province. It's so rewarding to see actually the different cultures and the different beautiful communities that we have. And they're all very, very different in each of their experiences. And we have needs in each and every one of those communities. And we have nurses, registered nurses present in most, if not all, of them. So again, I think it's listening to the voice of those nurses. What we have tried to do is make sure that there are representatives in each of those communities involved in our work. And then they take the strategies that we're building and actually help us implement with the flavor of what their particular community needs are. So when we set up the supports and toolboxes and broad systems of the work that we've done, we rely then on the sites to take that and make it their own. We know we're not all the same.
Absolutely.
We don't want to all be the same, and the approach can't all be the same for each community. And so what might work in St. John's likely isn't going to work in one of our smaller
Absolutely.
communities. It's hard though, isn't it, to keep that in mind and have something that fits everyone. So we do need the local involvement.
Absolutely.
We've been doing things like meeting frontline at those sites. We've even had our senior team and board and our retention group out there in those communities to see what might work. We've made some different strategies within each community very different in terms of what the high priority needs are, or what's available in a community and what's not available in a community.
Right.
So if a particular community, for example, has no facility for let's take a physical exercise, and that's something we can support within our own organization, then we will make that a priority for that community.
Okay.
If another community has a priority that's different than anything we've mentioned, we'll try to build that in.
Okay.
So it is really trying to find that individual community's needs. We've been working and meeting with municipalities as well. So the leaders in our community have their pulse on the temperament, also the future, what's happening within those communities. And we have wellness coalitions throughout our organization that work with community partners. We do find in a lot of our rural communities, it truly is a full community partnership approach to wellness that we're building. And so making those partnerships as well is really, really important to us.
Very interesting.
Absolutely. And Kelly and I are both from rural Newfoundland, and we moved in the big, metropolis, I call it, of St. John's to urban center. And I think now, like, if I had heard the things or had been privy to those things back when I moved in here in 2009, I might have stayed on the Burin Peninsula and stayed at, the Burin Peninsula Healthcare Center to work if those things had been in place. So
Absolutely.
it's really exciting to hear that, those strategies are being put in place and that each of those different geographic regions are being accounted for, because I think that will certainly help to retain nurses in their hometown or in those rural and remote isolated communities.
Right.
So thank you.
Very
So
important.
this is exciting. So it's great to hear.
Absolutely. Michelle and I sometimes hear from registrants. We receive practice calls, and sometimes their questions are related to work-life balance, scheduling, compensation, and of course the college doesn't have a role in employment. So as the employer, what are some of those key initiatives that you would like nurses to be aware of?
Work-life balance is so important for us all, and we do hear that from all of you, and everybody within NLHS is committed to improving the work-life balance for each and every member within our team. So we've started some work on that. Again, quite challenging in the current environment, and we know the demands are quite high on our practitioners.
Sure.
But introducing concepts such as self-scheduling is paramount. We're hoping that people have embraced that, and within each clinical setting, there's an ability to take some control of the self-scheduling. Interesting to talk with even new nurses that are coming out and what they're looking for, and trying to match what we have to offer with what they're hoping to achieve with their own personal lives. We know that it's very difficult to recruit into some of our communities. Our new nurses, and even some of us as well who are already part of the team, we choose and want to live in certain areas,
Yep.
yet our vacancies and the practice needs exist in other communities. So we're trying to come up with, in partnership with the nursing union as well as the Department of Health, new creative ways to make this an ability for people to achieve their own personal goals.
Okay.
So we are about to explore options such as a fly-in, fly-out model for people.
okay.
And while first and foremost we want people to embrace living in communities and be a part of that, we know that just can't work sometimes for everybody. So being able to accept a position in a part of the province where there is a vacancy and live in another part is new for all of us.
Absolutely.
And what we want to do is support people to be able to do that. So we've talked with our students about it. We're exploring how that might work, and stay tuned for more along that. We're also exploring a concept such as working in sister sites.
Oh, okay.
So maybe we can pair up a couple of like practice areas, but across geography, and we can support you to work in both. Mostly maybe where your home base is, but then you're trained and able to, and a part of a unit that is in another part of the province that has a gap.
Wow.
Maybe it's your hometown. Maybe you want to go
Absolutely.
back for a visit for a little while, or maybe explore a part of the province. So we're really trying to match how we can make someone's life be what they want it to be, as well as meet the needs in the clinical setting in the province.
Wow, that's very innovative, very creative.
Absolutely. I
yeah.
was just going to say that, Kelly.
Yeah,
It's so motivating to hear it. And so, nurses need to stay tuned. So, because NLHS is really, becoming that so creative and coming up with those retention strategies. So,
Yeah, and again, these are all ideas that have
Yep.
come forward from what people's goals are within their lives, and trying to match that with the needs we have in the province. It's no secret we're trying very hard to reduce our reliance on agency,
Yeah.
but it just remains that there are places in the province that we still have significant gaps.
Absolutely.
This might be a way
Absolutely.
to
Wow.
make it work for everybody.
That's
Yeah.
exciting. Absolutely exciting. So, Collette, we acknowledge that Newfoundland and Labrador Health Services has worked very hard to overcome some of the challenges over the past number of years. From what you've said today, there still seems to be there's work to continue. What can nurses expect in the short and long term?
There's a lot of work to continue. There's certainly many things that we're looking to improve, and we're hoping this is just the first of many, many steps towards developing a fulsome retention strategy. So what you can expect is more work on the 4 initiatives that I mentioned: the Grow Your Own, the Anti-Racism Campaign, our leadership development, and our wellness strategies. So we will continue to deepen and expand those. But you can also expect an extension of that work through the Retention Task Force.
Okay.
So the more people we have involved, the more ideas and more things we can start to leverage. The more creative we can be with some of the options I've talked about, the more we might meet your needs as a registered nurse. And that will all keep people content and hopefully help retain them within Newfoundland and Labrador Health Services. Each and every nurse will have a career path developed with them, and we're hoping to support them in it. And so the future of nursing is really whatever we want it to be, individually and as a group. As we move forward, you'll see a lot more of a culture built within NLHS. We're a brand new organization,
Yeah.
and we've had a tough start. We've come off a pandemic. We've had a great demand. We're living in a world that has a nursing shortage, and we're a new organization bringing 5 previous entities together. It's been quite a transformation. But we're settling. We're going to try to build with you the culture that we all want it to be.
Perfect. And Collette, you talk about the retention task force, and that is, focused on frontline members, I guess would be a part of that, volunteer, and you're looking for registered nurses
Yes.
to be a part of that, which is excellent. How else can nurses become involved in the retention strategies?
So I think the voice of the nurse can be heard in many, many ways. We have councils within the units. We're trying to build even more, so more to come on that,
Yeah.
where nurses can have a voice. I think in the retention strategy, one of the key roles for the nurse is supporting each other and supporting our new clinicians that are coming in. We want to welcome people into these roles and into our communities, and we need to recognize that building a new life here is very, very difficult, especially if you don't have the right supports around you. So let's make sure that we're providing that for our new nurses. We do have a lot of different work pieces going on that you'll see for call-outs, for voices, and for participants, including things like I've already talked about, but you'll see more to come by site, by geography, needing people to speak from their own experience and where they are, where they're living. The voice of the nurse is always welcomed and needed in that vein. And also, we have the formal things throughout the organization. We've just completed our accreditation work-life survey, and we're just seeing the results of that. In the upcoming months, you're going to see the results of that. And there's a lot of recommendations in there from you on what we could be doing to make the work life a lot better. And we will be listening. You'll see us on the road out to your communities. You'll see leadership, but you'll also see the retention task force coming with those results and saying to you, we've heard you through the survey. Now tell us more, and here's what we have planned. And does that seem to work? Does that resonate with you? Is that something that you're interested in that will meet the needs? So all kinds of things that are happening, and please come out and participate and hear us. And if you can't come to us, we're coming to you on your units, because we also know that's a challenge. So expect that and talk with us.
Absolutely.
Excellent.
Collette, just going back through, over the years from, working at Buren Peninsula Healthcare Center to now to, the Provincial Health Authority, change management, we've heard that term all the time. And one of the common complaints I've heard is that, we haven't asked the frontline registered nurses and nurse practitioners for input. I think you've really addressed that deficiency, is that you really are asking for the voice of the registered nurse and nurse practitioner to give those possible solutions, to work with the leadership team to bring about change. So I think it's just wonderful that you've really embraced those principles of change management.
Mm-hmm.
And we really do want the nursing community to be involved. We can't make it without you. We need to build this together. And so your voice and your participation is so critical. And we need you to help us make it better for you. And we're committed to work with you to do that.
Wonderful. So the merger of the 4th health authorities with Newfoundland and Labrador Centre of Health Information, I caught on when you said the 5, to one provincial system was a monumental undertaking, I'm sure. A move of this kind doesn't happen overnight. Do you feel the merger has helped recruitment and retention efforts across the board?
I do. It's been an incredible learning. All of us were operating very independently prior to the merger.
Yes.
In fact, so much so, probably competing for the same nurses. I hear stories from the schools, and we knew this, but it's interesting to actually hear that in previous years, there would be 4 different days, 4 different recruiters for 4 different health authorities. What's happened now is when you reflect on the needs of the province, this aligns so nicely because we have a view now to where the risk for patients are, where the biggest care gaps are, where places are in the most need, where nurses are feeling the most impact, and we can help make decisions as a group and prioritize appropriately based on that. It's been a shift. It's been a huge shift. And so, again, some of these models that I've talked about, such as the fly-in, fly-out, or trying to meet needs of communities that normally find it very difficult to recruit, are becoming the priority for the recruitment team to meet fulsomely across the board the needs of the province. We've also implemented some programs to stretch resources and help each other. We have the Nursing Locum Project, for example, that allows nurses to perhaps express interest in working in Labrador. So there are some opportunities there which were not possible before. We are able to learn from each other. The best practices throughout the province have been shared now.
Yes.
And boy, there are some gems there that each of us were doing independently that now when you put it together, it's really creating a great strategy Things like entering into high schools at certain times of the year, knowing which communities have gaps and where we might talk to those high school students about considering for career development.
Oh, great.
Collectively knowing the needs so we can work with our post-secondary institutions to develop programming that will be available to meet the demands as one voice, and seeing the vision that we have, which is making our province healthier together, has been just an amazing learning for all of us.
That's exciting.
It's
Absolutely
exciting.
Nursing practice, Collette, has evolved so much over the past couple decades, and the way nursing care, is performed for clients now has shifted as well. With the increased competition and an abundance of options, what would you say to a nurse who is looking to join NL Health Services, and what future potential is waiting for them?
It is an exciting time. We've just talked about that. I would say as a province, we should all be very excited where health is going and developing. We are so fortunate to have the Health Accord work completed under the leadership of Sister Elizabeth and Dr. Parfray. It has set a vision to turn the province's health outcomes into something that we can all be proud of. It's a 10-year plan.
Yeah.
It's a heavy lift of a plan, but we are all committed to it, and you can see the first elements starting to have impact. So if you join us, you're actually on a transformational journey. You are coming to an area that has embraced wellness and is willing to do the work to move us into a very proactive, excited, wellness-based community. And so to be a part of that, you don't get to do that very often in your careers. And nursing professionals are so important in this journey. The influence and responsibility we have to the community, to the public, to our patients is just incredible. We need to recognize what a role we have in trying to shift the province into the new culture way of being. And boy, the opportunity is just, it is really visionary and exciting. So stay with us on it. And I know that it sometimes feels like a long road. It's a long road because it's huge work and huge change.
Yes.
And it's going to be incredible. So as a nurse, come be a part of that. We also have incredible nurses to work with. We also have incredible leaders who are really trying, as I've said, to listen and make things better, and admittedly do not have this right yet. So come help us, and we are going to work together to make it so.
It really does sound like there is an abundance of opportunity for nurses to join Newfoundland and Labrador Health Services right now. Just so many different initiatives happening, and the emerging leaders. That's excellent. If anyone did have wanted that career path, investing in your own is remarkable. Really good.
Absolutely.
Excellent.
Inspiring.
Yeah.
Okay, so that concludes our episode with Collette Smith from Newfoundland and Labrador Health Services. Thank you, Collette, and thank you to our audience for tuning in today for the episode of Retention of Registered Nurses in Newfoundland and Labrador's Health Services. Remember, all episodes of this podcast can be put towards your continuing competency requirements. And also remember to subscribe to our channel, and we encourage you to like, review, or leave a comment wherever you can. Thank you.
Thank you.
Thanks,
This has
Collette.
been a presentation of the College of Registered Nurses of Newfoundland and Labrador.